Hi, my name is Missy Cohan, and welcome to New Beginnings to Health. New Beginnings to Health is about introducing people to alternative therapies to allow them to discover optimal health. I am very excited to have with me today Lisa Vasile. Lisa is a functional medicine nurse practitioner, a speaker, an educator, a writer, and most importantly, the mother of 3 teenagers.
Mm-hmm.
Lisa received her nursing degree from UMass Graduate School with a subspecialty in education. She then went on to a postmaster's degree in holistic health after serving 5 years as an Army nurse. Thank you for that.
Welcome.
She has most recently completed all her requirements for a certified gluten practitioner, has been interviewed twice for health segments in CNN, and is currently working toward her certification in functional medicine through the Institute for Functional Medicine. That's quite the biography. Thank you for being here.
Keep me busy.
Yes, absolutely. Lisa is also the co-owner of For Better Health, which is located in Hopkinton.
Yes.
Yes, excellent. So Lisa, you are clearly a lifelong learner. Can you please explain to us what functional medicine is, the ultimate test?
Yes. So For Better Health is a functional medicine practice, and it's myself and a physician. We are trained in traditional medicine, which means that we had the same hours, the same training, and both of us worked in traditional primary care. I also worked years in OBGYN as traditional practitioners. Mm-hmm. And what we found when we did that was that we could only do so much with the toolbox that we had. So a lot of times people will say, I have high blood pressure, and so I take this pill, or I have high glucose, which is diabetes or prediabetes, or I have high cholesterol, and they take something for it, a headache, stomach aches, heartburn, whatever it may be, mm-hmm. and those medications, even if they're over the counter, considered medications, are treated to stop the symptom. So what functional medicine does is say, well, why are you having that symptom?
Right.
So it's almost like if you had a rock in your shoe, and I said, that must really hurt. So here's an ibuprofen, but you don't take the rock out of the shoe. So it's going to feel better, especially when you lay down at night and you're not on the foot, but when you get back up in the morning. So we're trying to find out where is the rock in the body, mm-hmm. and what's making everything go awry. It's state-of-the-art science. It's finding the one thing that may be off, and it may be 2 or 3 things that might be off, mm-hmm. in the body or in the lifestyle that is tweaking the whole body.
Right, that's causing problems.
Right, so instead of reducing the blood pressure with the medication, and if you go off that blood pressure medication, it goes up, mm-hmm. we make the blood pressure go down, and then we can get people off that medication.
So what are some tools that you might use to help that person get off of the medication for the blood pressure or the sugar pill?
Sure.
Or
so diet.
Yeah. Key thing,
yes.
right?
Dr. What is her name? She's a MS survivor.
Okay.
What is her name? So it's a W. I'm not going to remember it this second. But she is great because she talks about how when she first changed her entire diet and found that healthy fats and lots of green vegetables and lots of real colorful vegetables and some fruit, high quality proteins, taking away all the things that aren't those. So mm-hmm. not so much I can'ts, but more I can's. And then she found that her MS symptoms really kind of changed. And so that can be with anything. And I'm not saying that everybody can heal MS, but I'm saying that that's one of the great finds is that in our traditional world of fast-paced, very busy, everyone's got something to do way too many times in an hour. Mm-hmm. And that's anyone. That's the working dad, the working mom, the stay-at-home dad, the stay-at-home mom, and all the people that are taking care of the kids and their grandparents and their parents and their coworkers and their sisters and fitting in all the different things on the agenda. So diet tends to go sort of to the side.
Like you said.
So diet is number one, and not just what we're eating, but what we're drinking. Because when you think about what we're drinking on a daily basis, most of us are putting a lot of sugar in our diet that we're not thinking about, whether that come from, Starbucks, Dunkin', whether it comes from, a Red Bull, soda, Gatorades, any of those things that are loaded with sugar, mm-hmm. and those can really tweak the body and blood pressure and blood glucose and diet and weight. And then looking at also what are we missing. So when you're eating a diet that's not nutrient dense, which is, a lot more processed food, a lot more takeout, a lot more restaurant food, the faster fill the hole kind of food, you're not getting as many nutrients. And so those nutrients are missing, even if you have the best belly in the world. So if you ask, 1 in 5 people, they're going to say they have, it's usually 3 in 5 people have something with their belly, and that might be IBS or bloating or heartburn or all of the above. And that means that they're not getting all the nutrients, even if they're eating a super, super diet. So there's all these different pieces. So that's just nutrients in diet.
Right.
And then so that's really number one, but along with that is lifestyle. So you can't eat a more nutritious diet unless you look at your lifestyle. What's happening in your life? How are you going to get the food in and the nutrients in if you don't change something? And so whether it be planning, shopping, prepping, and that shopping could be that they deliver to your door when you get home from karate class and soccer,
But not restaurant food.
It depends where you're eating and how much you're eating, because that's the other whole thing that goes along with nutrition. So a lot of times people are overeating the things that aren't as nutritious and undereating the things that are nutritious. So when you go to a restaurant, the enormous plates of pasta and then the teeny tiny 3 thin crowns of broccoli. So,
Right.
It's a little bit skewed as to, and then if anyone was served, people that are expecting that are served, a small piece of fish and a bunch of vegetables, they're like, oh, geez, I got gypped.
Right.
So there's that whole condition that we're in,
Mentality.
the mentality that we're in. You want more for the buck, more for the bang for the buck.
Right.
And then you're looking at how is it made. So are we, you sit down at a restaurant, most people open up the menu and try to decide what they want. And a lot of times the things that are chosen are the things that are more filling and more emotionally satisfying, whether it be because you had a bad day or because you're stressed or tired, and all those things. Those carbohydrate-rich foods tend to feed those. And then also, while they're waiting for the food, they're eating the bread, right? So, or having the cocktail that's then skewing what they're going to eat later. So it's about how to eat, chewing. Nobody chews enough. I will admit that I don't always chew enough. So when you're chewing, it starts out a process of how we're getting the nutrients from the food. And so if you're chewing 2 or 3 times and then guzzling a giant glass of water to make sure it goes down, you're reducing the ability of getting the nutrients from the food. So just teaching people how to eat, slow down, eat at a table. So I'd say 50% of people are eating without a platform. So that means that they're either eating standing, they're eating at a desk, or they're eating food that comes through the car window. Or out of something in the car. So there's no platform, and there's no patience, and there's no actually looking at the food and are you still hungry for that food, that kind of thing. So a lot of diet, nutrition, lifestyle. And then some people, like you asked, may need a boost with those nutrients. So they might have something with their gut that's not working super, and when it's not working as super as it is, we may add nutrients in until they can get to that, not even optimal level, but even baseline level of where they should be.
Right. So what kind of people do you help with this? It kind of was a general description of you can help the working dad, the stay-at-home dad, the working mom, the stay-at-home mom. So what kind of symptoms do these people have that might come to you for
Right.
a functional medicine consult?
So I see patients that are anywhere from 13 and up, and those patients can come in with, for the majority, I'd say the top 5 would be a dietary issue, like a digestion issue, excuse me. So that would be IBS, constipation, diarrhea, bloating, pain, heartburn, swallowing issues. And those people may have been to 1, 2, or 3 other people and just haven't gotten better, or the medications they're on to treat it are now doubling, or they're taking 2 or 3, and now they have 2 or 3 other symptoms that kind of go along with that. That is number 1. And then we have a lot of hormone, and those hormones might be hormones as in testosterone issues, or women with fluctuating menstrual issues, or perimenopause, postmenopause, a lot of thyroid, and a lot of adrenal gland, which goes in that whole hormone cascade. And adrenal glands are those teeny tiny glands that sit on top of our kidneys. And so those are in charge of everything that I just talked about before. Got to get through the day. I have 750 things to do. And unfortunately, the person that's doing all those, tends to come sort of at the bottom of that list.
Right.
So what that does is sort of make those adrenal glands go, 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 like the Energizer bunny. And unfortunately, there's only so much juice in the bunny battery. So what happens is that those guys can kind of skew the hormone cascade. We have a lot of the people with the chronic conditions like we talked about, so that might be diabetes, heart disease, even prediabetes, or someone that has a lot of heart disease in their family. Somebody that might be either on a cholesterol medication and wants to come off, or is being told to go on and they don't want to, or they're on one and they're told they might need more. Somebody that might have already had a cardiac event, heart attack, stroke, and wants to see what they can do to, decrease the risk of more. And then somebody with maybe diabetes or prediabetes. A lot of people will ask me if I see patients with issues with losing weight. That's not really one of our major diagnoses that people come in with. I want to lose weight, but most people will adapt a different lifestyle, different diet, upregulate their hormones to work better, and then they find that their weight will definitely get to a better place.
Right. And I think that's what I coach a lot of people on, is not so much that, like, yes, you want to lose weight, and that's why a lot of people come to me, but you have to get everything in balance before your body can get to a point where it's comfortable letting go of that weight, whether it's a stress reduction, improving the diet, combination of everything. So you are a nurse practitioner. You used to health coach, right?
I did.
You did?
Yeah.
And moved on to nurse practitioner because?
I was a nurse practitioner already.
Right.
So I had graduated, I was working as a traditional NP and was doing health coaching on the side. And part of the reason that I stuck with the health coaching was because it's a little bit different than nurse practitioner in the role that I was in and in now. It's patient comes in, I have a lot more time now. It's a lot different in my practice. It's 40 minutes to an hour and a half with a patient versus it's usually 10 minutes in a traditional practice. And so it's find out what's might be bothering them or what they want to work on, and then give them some ideas, do a quick evaluation of their physical assessment, and then give them 1 or 2 tips, and then go on, and then they don't come back for 3, 4, 6, 8 months, maybe a year. And so I would see patients coming in, and they might be my GYN patients that are there for their physical, and last year we're talking about maybe constipation and headaches, and I said, you should try a little magnesium, and they come back, oh my gosh, that magnesium worked awesome, but I see that they're on 2 new medications for something else, and so I'll say, well, did you do this and this? Yeah, lifestyle. So did you work on some of the stress? Did you work on sleeping is a huge issue. So we see a lot of people with fatigue and sleep issues as well. So did you work on this and this? Well, no, the whole idea of chiropractic, acupuncture, I'm sure you've talked about those on your show. Did you incorporate those things like neurofeedback, or things that are going to sort of help you, yoga, meditation, doing some tapping, things that are going to help them to sleep. And so it's a whole year.
Right.
So with health coaching, you get to have that benefit of the accountability. Are you doing it? Are you not? Why aren't you doing it? Is it not working? Let's try to find something else that might. And also the support of little baby steps, right? So you don't have to do a whole bunch at once. And so what I found is that I was still feeling frustrated because as a health coach, you're not allowed to, as an NP, I know that you can order these tests that are going to find something. So one of the other things that we do is not just lifestyle, but also state-of-the-art scientific testing. And these tests are out there, but as a health coach, you can't prescribe them. You have to send them to someone to go ahead and order them. So I decided to step out of that role again and go back into the more functional medicine role as an NP.
Which just gives you more availability to those testings that we talk about.
I can do the testing, I can do prescriptions if people need them, I can support them in changing prescriptions if they need them. It might not be that, I don't believe that medications are bad, I believe that sometimes it's just not the perfect, not everyone needs that one drug, it might be a different one that might be better for them or work better for that unique body. A really good example is thyroid. So most people will say, oh no, I was tested for that, it's not that, with the fatigue or whatever symptoms they might have, hair loss and weight gain and things like that. And so I'll look at their number, and their number may be that it's in the normal range, but a normal range for thyroid is like 0.5 to 4.5-ish. And so theirs might be 4.6 or 4.4, and so it's kind of like a D- in my book. Like I'd rather have the A+. So I'll say, well, let's look at some other labs that actually feed that thyroid. So that TSH number that a lot of people out there are saying, oh yeah, I have thyroid, I check my TSH. That number actually is a pituitary hormone. So what we want to look at is the actual hormones that come from the thyroid, and are those being supported in the body with 6 or 7 nutrients that actually help us use the thyroid hormone. So then we go from there and support someone. If one person only needs T4, then they only get T4. But if they only need T3, then they only get T3, which is the breakdown of that. And then they may need both. So it's really cool to have that availability as an NP, which I couldn't use when I was functioning as a health coach.
And I think you bring up an interesting point too, and I want to touch on this. We talked about this a little bit before. How do you see functional medicine and conventional medicine kind of melding together? Because I do think there's a meld.
Thank you. I agree. I think it could work really well. I had somebody say to me today, I usually only send people to you when I don't know what else to do, who was at primary care. And she goes, she kind of came in and shadowed me. And she said, but that's crazy. Why don't I send them to you first? And then if you need a referral to someone else, like an endocrinologist, a dermatologist, whatever it might be, one of the ologists, then you can send them back and I'll send them to the ologist. And because a lot of those conditions, skin conditions and GI conditions that we can really curb with a lot of things that we're talking about.
Right.
So yes, I think that it would be wonderful. And I think it actually will, in the long run, cost a lot less money and a lot less quality of life lost to the patient.
Right. I also see now that a lot more companies are opening up wellness workshops and such. And you do some of those workshops.
I do.
So do you want to talk about that?
It depends on who's doing them. I show like this just to get people to know that there's other avenues of optimal health. So I do think that there's an acceptance in the world that getting older means getting sicker or getting weaker or getting more in pain or not sleeping well, and that's just who we are and our hormones and whatever
it's all part of getting older.
Yeah, and so I just don't agree. Certainly our body is going to change, and I'm all over that, and I think birthdays are great because what's the alternative? That's not good. So let's go ahead and make it as optimal as possible. So I think it's accepted and it is common to be tired or uncomfortable or not sleeping well or on medications for those things that we've talked about, blood pressure, cholesterol, whatever it might be. But it's not normal. Right? So it's common. And many people my age are on medications, but it's not normal and it's not optimal.
Right.
And so those medications might make you tired and those other things. So I do think that there's a way that we can do both by working together as a team, the traditional and the...
Yeah, and I think too, it's really interesting to me that I see physicians who will order the TSH, like you said, and say, oh, you're fine, but never look deeper into the problem, despite the fact that the patient might have some symptoms that suggest, how do you deal with something like that? Or because you're in the functional care medicine, you can order the test for yourself.
Right, I could definitely give the patient a lab slip and have them go to the lab themselves, but for the benefit of the doubt on the traditional practitioner, some of their training, it isn't giving them this piece. So the functional medicine training is going to the root cause. Traditional training is fixing the person when they're broken.
Yes.
So it's very, very good at doing that. So if you get in a car accident, have a heart attack, if you have a really bad infection, you get really good care. Traditional medicine is very, very good. They save lives over and over all the time. But it's not as good at the things that don't fit into that algorithm, right? So the person has every symptom of thyroid or every symptom of a skin condition or whatever it might be, a migraines, but what they're doing on their algorithm isn't working, and so they don't have anything else in their toolbox, which is kind of a shame.
Yeah.
Plus, they don't have the time.
I was just going to say that. Yeah.
So it's not that they're. I have a lot of people that will say, oh, they don't want to spend any time with me. It's not that they don't want to; they don't have it.
Right.
So they're forced by their, usually by the company they work with, or by their schedule, to see more and more and more patients, and they really, really have actually get knocked down. So say somebody's a diabetic in traditional world. If I was practitioner, and you came in and you were the diabetic, and you had an appointment today, there's certain markers I have to do for you. So you have to come in every so many months. You have to have we have to have these 3 discussions, whether it be diet, or stop eating sugar, but you and I both know that there's more than that. And then they have to do these 2 or 3 different blood tests or urine tests. So that has to be done every 4 to 6 months on your record.
Within that 10 minutes.
Within that 10 minutes, on your record. And if you decide, I'm going to go to the beach today and I'm not going to get through the lab, I, as the practitioner, get dinged because you didn't follow through with your appointment.
Interesting.
So it's just a different approach, and I don't think people are seeing that. I'm not forgiving the fact that there are people that are practitioners, and it doesn't matter if you're talking about, someone at a dentist office or someone at a veterinarian or someone in a medical practice. There are people that just aren't super friendly and super caring and empathetic, and they may discount people. I get that.
Right.
And so I think if someone is feeling discounted and they really know that there's something wrong, they should be empowered because they're paying for insurance. They're paying for their health, and they should get to answers.
Right.
And
so they can
almost
explore another physician either within their health
Absolutely.
insurance, or they could come to you, but you don't take insurance.
Nope.
Because, do you want to explain why you can't?
Because the insurance world, unfortunately, is paid by structures like I just talked about. So you have 5 things that you can order and only those things, and you can give these medications and only those medications, and you have to do it in less than 10 minutes. And so we know that doesn't get people to the root cause. It really works okay for, say, 20% of people. It does. I don't know that they're at the optimal. They're at the good normal, and that's okay. But there's a lot of people
So
that
they're
doesn't
like
work for.
sea level.
Yeah, maybe C+. But those people that aren't fitting there, there's a lot that are frustrated, sad, tired, hungry, headaches, brain fog, you name it. And there's just no algorithm for that, unfortunately. If there's nothing wrong in your MRI, then there's nothing wrong with you, which that isn't true. So the other reason that we don't take insurance is because it's a lot of times these algorithms I'm talking about are actually set up by the pharmaceutical companies.
Interesting.
And so if we're going to do this, it has to have this medication, then that medication, then that medication. You can't go from here to there. And so, or you could, but it's just, usually there's a big brother watching saying that that's not the way to do it. So it for the most part, I don't think there's anything wrong with that. I just think that it just doesn't work for everybody. It's not bad. It just doesn't work for everybody.
Right.
But that doesn't mean that people don't get some of their what they pay for our visits, just seeing us. A lot of them get reimbursed by their insurance, and then our lab testing, for the most part, is actually covered by insurance.
So some things are and some things aren't. Yeah. So when you work with health coaches, health coaching, a physician, a traditional physician, or someone like you might send someone either to a nutritionist or a dietitian or a health coach.
Correct.
Or maybe a mix of them. Can you talk to what the difference is between the 3? Because I get that question all the time. Well, aren't you a nutritionist? No, I am a health coach. So can you answer that for them?
I can. So a dietitian is typically gone through a traditional schooling for a dietitian school, and they have a dietitian license. They have like a certification. Nutritionists can do the same thing. And actually that nutritionist and health coach has a real gray line between the two, quite honestly. So dietitian tend to be those people that are actually insurance would pay for them. So for the most part, insurance doesn't cover a nutritionist or health coach unless someone has some kind of a package in their policy. And so most traditional practitioners will refer to dietitians because they're in the insurance model, and a lot of them in today's world will stay within their group. So something in this area would be like a tri-county or a Southborough medical group. And you'll go see that dietitian because they're in my group, and so that kind of works together, right? The nutritionist works in a similar role. They tend to be somewhat more open to the idea that supplementation can be incorporated. They may do some testing and other things. Health coaching, on the other hand, can do some of that as well, but most of them, it's more, for lack of a better word, hand-holding.
Right.
So you're teaching them how to make a menu, how to shop at the store, how to prep the food, what's in your fridge. Let's go through your cabinets. Let's go grocery shopping together. Tell me why that isn't working for you. Right. What's your lifestyle like? Those kind of things that are feeding everything else that we've talked about.
Right. Excellent. It was so wonderful to have you on the show today. Thank you
Pleasure
so
to be
much.
here. It really was.
Thank you. How can people reach you? Because you know people are going to want to be reaching you.
We have a website for betterhealthmedicine.com.
And that's the number 4.
Yeah, the number 4, betterhealthmedicine.com. And that's right in Hopkinton. And you could call us at 508-625-1807.
And that will be on the slide at the end of the show. Thank you so much for joining us on New Beginnings to Health today, and have a wonderful evening.